In good systems thinking practices, sequencing matters as much as the acts that are being sequenced. With COVID-19, getting the sequencing right is more important than ever as millions of lives are at stake. Entrepreneurs have perfected the sequencing of business deployments down to a science. And recent examples are Elon Musk's master plan to chain-link technological steps towards a solar economy, and Bill Gates' famous Innovating to Zero plan to fight global warming. Both interventions share something in common. They spend a lot of time thinking about how things fail, and then decide where you can actually intervene and the order it should be done. Now more than ever, we need to innovate to increase the value of our healthcare system's capacity to fight this virus. Let's take a look at the order these innovations need to be deployed to get out of this COVID-19 hell. Think of these first 3 steps as stepping stones until we reach the 4th, global deployment of a vaccine. When you stay at home and distance yourself from family and friends, you're practicing what is called non-pharmaceutical intervention, or NPI. Non-pharma interventions matter because they're the low-hanging fruit of the disease control tree. You don't need to develop or deploy any new technology, and it can be done immediately. If we could force every human to hibernate for 5 weeks, we would all wake up in a COVID-19 free world. Germs are social creatures, so non-pharma interventions are social responses. The goal of non-pharma interventions is to buy us time so we can work on the next stepping stones. The only real alternative to non-pharma interventions and distancing rules is aggressive, continuous testing. If I know I'm not sick, and I know you're not sick, we can have a nice meal together or a play date. Right now, this technology does not exist, and we need it fast. Many companies and laboratories are already working on it, and some pre-screening tests are now available. The more it looks like the way diabetics can control their glucose level, the better. Self-administered, rapid, and affordable. If we can flatten the curve and improve testing with stepping stones 1 and 2, we can buy time for medical research to work its magic. We are seeing more creativity in ventilator design in the past week than in the previous decade, and an improved supply chain of personal protective equipment is being created at this very moment. The most urgent breakthroughs right now are those who protect the lives of our first responders. In addition, many clinical trials have happened right now by experimenting with different drugs to identify effective treatments. Thankfully, good treatment, unlike vaccination, does not need to be produced on a large scale. Once available, if we can rapidly produce hundreds of thousands of units, we can make a big difference, and innovation-friendly public health policy can help accelerate that process. So the more we preserve the capacity of the system by following stepping stones 1 and 2, the more lives we will save when stepping stone 3 gives us better medical interventions. Potential SARS vaccines have been in the freezer for years, but many reasons have prevented their distribution. The good news about this is, a COVID-19 vaccination is not an unimaginable scientific problem that will require years of research. This does not mean that producing a vaccine will be easy, though. The knowledge on how to produce a vaccination exists, but the failures to produce a vaccine are mostly market and regulatory failures. Poor global public health policies play a large part in why we don't have better tools against pandemics. But much can be done to make sure we have the vaccine earlier than normally expected, such as streamlined approval processes, funneling public taxpayer money into medical research, and encouraging companies to make a vaccine that probably will not be very profitable. Manufacturing a vaccine that billions of people want to receive in a short period of time presents a problem that the public health system has never confronted in modern times. While we know how to give vaccines, we'll have to learn how to do it fast. Each stepping stone is critical in increasing the capacity of the healthcare system to innovate to zero COVID-19. Without discipline, the system can regress and lose capacity, which can force saturation in the system, and when the system saturates, people die. Innovating to zero COVID-19 is the most important sequential innovation challenge of our generation. Humanity's future depends on the first responders, who are risking their lives, and on the entrepreneurs and scientists who are needed to provide a final solution. The job of the government is to give them everything they need to do their jobs. Our responsibility as citizens is to buy them time.